let's talk about the CT scan findings for appendicitis. So what is appendicitis? Appendicitis is the inflammation of the appendix. So what happens in appendicitis is, this is the cecum and this is the appendix, right? And this is ileum part. If there is some obstruction of the lumen of the appendix, what will happen is there will be fluid collection, and this fluid collection will be infected by the bacteria, mostly anaerobic bacteria, and there will be inflammation, and this inflammation will lead to the appendicitis, right? So why obstruction occurs? It occurs because of, there are many reasons, but the most common cause is fecal leaf, right? If there is a fecal leaf, or if there is seeds, right, seeds of various food, then it can be cancerous growth also. It can be cancer. Okay, so any kind of growth that can cause this. Now if this inflammation is not treated, okay, this can even lead to perforation, and the perforation occurs from the tip, mostly from the apex there will be perforation, and so there will be perforation and there will be peritonitis and patient can die. Okay, so this is the emergency condition. So whenever there is a appendicitis, okay, what we do is we remove the appendix so that we can prevent the further complications. So how the patient will present to you? Patient will come with pain in right iliac fossa, there will be nausea, vomiting, and TLC count will be raised, okay, and when you examine there will be McBurney point tenderness. Okay, what is McBurney's point? If you draw a line between the umbilicus and the right anterior superior iliac spine, and the junction, okay, between the medial 2/3 and the lateral 1/3, okay, there is a point which is McBurney's point, and if you press in this region, the patient will feel tenderness. Okay, so this is a classical sign of of appendicitis, that is McBurney's point tenderness. So when patient comes to us, the investigation of choice is CT scan. Okay, so let's see what are the findings in the CT scan. You can see that this is the cecum and this is our appendix, okay, which is located retrocecally. Okay, this is the sagittal section of the CT scan, abdomen. So you can see that there is a thickening of the wall. Okay, wall is thickened, as well as the appendix is also, the diameter of the appendix is also thickened, and there is a surrounding fat stranding. Okay, and so this points towards the appendicitis. So what are the features of appendicitis in CT scan? Diameter more than or equal to 6 mm, right? Then wall thickness more than equal to 3 mm, right? And surrounding inflammation, and surrounding there will be inflammation. Okay, what you can see here is there is a air density. Okay, this black is the air density, and surrounding there is a abscess here. Okay, so this points towards the perforated appendix. Okay, so how to diagnose perforated appendix? There will be inflammation of the appendix, as well as there will be surrounding abscess and air outside the lumen. So these are the features, and you can see that there is a air outside the lumen, there is abscess here, and there is an inflammation of the appendix. So this points towards the perforated appendix, and if this is not treated in time, patient will develop appendicitis. Okay, and this is the emergency condition. The patient has to be taken to OT, and there has to be laparotomy done in this patient. Okay. Now what you can see here is, you can see that this is the appendix and there is a obstruction, okay, at the luminal side. This is a fecolith. Okay, this bright color is fecolith,